And welcome once again to Physician Center for Beauty. This is where the magic happens. This is the procedure room. Dr. McGuire is ready to go to work. Kybella, tell us a little bit about it.
Yeah, so it's a non-surgical injectable treatment for double chin. It's the first of its kind. We're among the first in the country to be able to offer this. It was just recently approved in the United States and has undergone rigorous testing. It's a very safe product and treatment. It requires injections here in the office, and we do a series of injections. So Alex has been kind enough to demonstrate this for us. She's unfortunately, is laying down, so you can't really appreciate some fat in the chin area, just underneath the chin. She's really a great candidate because she doesn't have a lot of loose skin, but just has some isolated fat right here, like a lot of us do. And we've done some marking here. I do this beforehand so that it's marked out in a very specific way so these injections are done very accurately. We've also used some local anesthesia, so we've numbed things up a bit. The procedure itself is pretty easy. It just takes about 10 minutes here in the office, and it's just a series of injections. And after we're done with this, we're going to be applying some ice. There's a little bit of soreness from this.
So for folks who may have a phobia or they just do not want to go under the knife, this would be a great alternative, correct, Doc?
Yep. So if they are otherwise good candidates from the standpoint of just some isolated fat with not really a lot of loose skin, then they may be a good candidate, and we would assess that in the office. For those people that maybe are a bit older and do have a lot of loose skin, surgery may be a better option for them, but I can certainly assess that with a consultation here in the office. You doing okay?
Mm-hmm.
We're showing a little bit of before and after. Doc, you mentioned the fact that a lot of the procedures we do here, I see immediate results. This would be a series of injections, correct?
That's right. So this takes about a month to see results from each treatment. So we're going to do this treatment. We're going to reassess in a month, then do probably a second treatment. And sometimes we'll do as many in a series. We might do as many as 4 or 5 treatments, depending on the situation and kind of depending on what the goals are.
Now, to me, doctor, obviously anyone who has a double chin and wants to take care of that non-surgically, this would be a candidate. Are there other folks who might be a candidate for this procedure?
No, that's pretty much it. It's those people that just have some isolated fat in this area, who are otherwise, good and healthy candidates. This is a pretty straightforward procedure. We don't want to put patients at risk, obviously.
Important to state here, and you did it in the beginning, but just so people can be assured, FDA approved.
Yeah, that's right. It's the first and only product of its kind that is FDA approved specifically for the treatment of the double chin.
Okay. For folks who are interested, again, a consultation, we recommend they can give you a call here at the office, Doc, and be glad to sit with them and look at the options, right?
That's right, because not everyone will be a candidate for this, and I can really help guide patients' decisions about what best treatment for them, whether it's surgery, a neck lift, liposuction, or the non-invasive injectable treatment that we're showing today.
We've seen some great before and after pictures, Doc. What kind of feedback are you getting from patients who've been through this procedure?
Well, mostly because this is a new procedure. We're just seeing patients that have experienced this for the first time, and they're describing a little bit of swelling for a few days, a little bit of discomfort the first day, and mostly just the issue of swelling for a few days, and then some firmness of the area. There can be some itching, for a day or so, but really not any significant downtime. And then those results are very gradual, so it takes about a month to see the ultimate result, and then we decide if we want to do another treatment.
Okay. Pros and cons when you put this side by side with plastic surgery. Doctor, I'm sure you get that question often. I guess it would depend on the individual and what they really want to endure. Is that correct?
Well, and it really also depends on the anatomy. So if they have a lot of loose skin, this is not going to substantially tighten that loose skin. So for older patients, for example, that might have a significant amount of loose skin, surgery may be a better option for them. For the younger person, for some men, for example, and just younger women that have some isolated fat with not a lot of loose skin, this may be a good option for them.
Doctor, I've always admired the fact that here at the Physicians Center for Beauty, you stay current with, cutting-edge technology. I know you've probably been watching this develop.
Yeah.
Did you think it would get this far, that it would get FDA approval?
I've known about this in the pipeline for about 2 years, and we've been following it until it was FDA approved just last month. But that doesn't mean that it's a new or novel product in any way. It's been tested for several years now, over several thousand patients. So we know that it's a safe procedure and it's an effective one as well in the right hands with an experienced injector.
Yeah, because I know the FDA approval is rigorous, but then they got to get by Sean McGuire. So, Dr. McGuire, you have your own standard as well.
Well, yeah, and I want to make sure that it's not only effective, but also that it's safe. So we do all this after rigorous testing and demonstrating on lots of people to make sure that we're getting good results in a safe way.
All right. Once again, it's Kybella. This is a new procedure, and from what I understand, Doctor, I want to be clear, you're probably one of the few people in this area that offers Kybella, correct?
Yeah, we're among the first in the country to offer this. So this is something that's brand new in the United States, although it's been tested for a long time, and we're proud to be among the first in the country to offer this.
All righty, we're going to throw some specials up on the screen here real quickly, just to show those real fast. I'm going to bring Marilyn Cannon back in. Okay, back up on the screen, you see now the specials. And Marilyn, if you don't mind, I'm going to bring you back in to go over those real quick.
Okay, well, we've got the Voluma and Juvederm special, which is coming up on... I'm sorry, I lost that.
That's okay.
Yeah, anyway, it's on the screen. Okay, great. So, a Baji Radiance Peel event, call in, that sells out quickly, $100 deposit, and you get 20 units of Dysport as well as the Radiance Peel. And then we've got the 20% off all spa services, July, that's for the rest of the year. Call in between, the dates up on the screen too, and then also our teen facial event.
All right, there you go. You got them all in there. Thank you very much. Dr. McGuire, thank you very much. Appreciate it.
Yeah, thank you for the opportunity to show what we do here.
All right, and Marilyn, thank you as well.
Thank you.
You know the number, 897-SKIN. Give them a call, Physicians Center for Beauty. Take advantage of these specials and events, and we'll see you tomorrow right here on Wave 3 Listens Live.
Like Wave 3 News on Facebook and join in on what's happening now.
When you're choosing a plastic surgeon, I think it's important that you understand their philosophy. It's key that surgery results look natural. I'm not interested in doing plastic surgery that looks like plastic surgery. A patient's results matter to me. What we'd like to do is complement the patient's feeling on the inside with the results that we're able to offer on the outside. I'm Dr. Sean McGuire, plastic surgeon and medical director with Physicians Center for Beauty.